Dr. Christopher, welcome to Adulting with Autism.
Thank you. It's nice to be here.
So, for all my listeners that are new to you, tell them who you are and what you do.
I am a psychologist in New Jersey. I specialize in working with trauma and complex trauma. Um, I have a podcast. I have a book coming out hopefully in the next few weeks called Now and Then, Complex Trauma and Disruption of Relational Time. Um, that's, I have a website. I also have a workbook coming out in the winter that sort of follows up on that book. But yeah, no, I've been a psychologist for about 20 years and a therapist in New York before that. So I've been around.
You center your work on the idea of people aren't broken. What does that mean in a practical, everyday language?
In practical everyday language, people, even those people with psychiatric diagnoses, are not necessarily, they do not necessarily have the diagnosis the way people intend them to. Let me explain. Some personality disorders, some features of personality disorders can manifest in a broken relationship. People can become very closed up and narcissistic. People can become very closed up and exhibit borderline tendencies. I refer to it as primal panic. They are afraid they're going to lose someone very important to them. And we don't like to see people as broken because we like to focus on what's right as well as what's wrong. And I usually make that a big part of the work that I do with people is tell me about what's going right for you. Wellness is important. We do gratitude journals. We focus on the things that people can sort of be mindful of and therefore distract themselves from anxiety. So, for instance, when there's an exercise you can do with your first bite of food in the morning. Hold it up, look at it, think about where it comes from, put it on the fork or a spoon and hold it to your lips, smell it, touch it. Okay, so there's a whole procedure that you can go through for like 10 minutes before it actually gets in your mouth. But during that whole time that you're being mindful, you're totally centered on that bite of food and you are not thinking about the thoughts that circle around in your head because it's very easy to get caught in that particular hamster wheel, especially with anxiety and some depression also.
What is the difference between a painful life experience, trauma, and complex trauma?
Good question. Painful life experiences, well, we all have those at some point. And again, as long as it's something that happens in the course of a normal life and like, for instance, getting caught in the rain, which I just was not exactly a pleasant life experience. My pants are soaked. But that's, it can also be an illness or a loved one or a loss, getting fired from work, getting some sort of disciplinary action, legal problems. Trauma, we generally think of as something really huge, like a plane crash or someone dies or we experience a life-threatening illness. That's legitimate, but complex trauma is a little more subtle and insidious. It is the absence of something as much as it is the presence of something. Presence of a trauma is one thing, but complex trauma is more like an absence of attachment. It's an absence of being able to connect with people. It's something that often happens early in life, but it can happen later on also. We can become so detached from a good relationship to caregivers, from a good relationship to people that care for us or that we care for, that we do not know what to expect. That's a big component of it. Hypervigilance comes in play here. I don't know what's going to happen and I don't know when. And so we start making up things based on experience or on our worst fears. So, he didn't return my text message, so I guess he hates me. Um, that person seems to be in a bad mood. They don't like me. So we sort of the reason I call it disruption in relational time is our relationships to people in time are disrupted. We are either hyper vigilant and looking over our shoulder, waiting for the next thing that's going to happen, or we rush to a foreclosed future and assume that we know what's going to happen next. Um, they call it crystal ball thinking in cognitive behavioral therapy. So, being able to focus on being here now, we can take a pause and we can say, okay, this thing happened. This person didn't return my text. What could that mean? Okay, I know what I usually say is that something's wrong. They don't like me. They're busy with somebody else. They have another relationship. Or I can assume that maybe I need to wait for an answer. Maybe I should ask the person what happened. Why did it take so long? So in that pause, we get choice. And in the choice is all the difference.
You explained that like childhood adversity and attachment injuries can quietly shape adult relationships and the sense of self. What are like common adult patterns that may have roots in early experiences?
Infidelity of a partner, the lack of assuredness in a job, the breaking of a friendship, a person who just disappears on you. All those things can sort of mimic those attachment problems in early life. If we don't have someone that we're firmly attached to as children, then later on in life, when those patterns tend to repeat or seem to repeat, even, they don't even have to be exactly the same. So if mom was never particularly close and we never knew what kind of mood she was going to be in when she came through the door, that's one thing. But then if someone is being withdrawn or cautious, we're going to think back on, oh, this is just like that. And it's not even conscious. Our nervous systems become wired to wait for things. We scan, we become vigilant, we become hyper vigilant, and our nervous systems are always ready to go. And then when we see something that's even remotely like a danger trigger, we assume that we're back there again. And it's funny, I talk about in the book about people say put a pin in it. And it really kind of does put a pin in something. You have a bad childhood experience, there's a pin there. You have an attachment issue, there's a pin there. And then you go through the rest of your life okay. But then when something else happens, you go back to that pin. And not only do you go back there, but you drag some of that forward with you in the sense of, oh, here we go again. I'm going through the same thing. Somebody I can't count on, somebody I'm not sure of, and it can disrupt the present. I often talk about how the past can write the future, but we all know from the song, the future is unwritten, and it is. And we can choose how that is written in the present.
Why might somebody who had a fine childhood still have meaningful trauma or attachment patterns?
What people call fine childhood, I've often found that people say, oh no, my childhood was great. And in their experience, compared to what it could have been or what other people have been through, I mean, because everything is a comparison. It could have been just fine, but there could have been uncertainty about, what's dad doing or uncertainty about how does mom feel. We may never have been really given an emotional intelligence or an emotional vocabulary based on we need to hear from parents what the feeling is. You fall down, you hurt your knee, and you cry, and somebody says, oh, are you hurt? We learn hurt. And we learn when it's appropriate to say that term. But if we just are basically kind of left alone to raise ourselves, or if we don't get full explanations of things, that can be a kind of an attachment problem also. We just don't develop the emotional vocabulary to handle some of the subtle stuff. And a lot of it is unconscious. It just kind of happens. And we're not even fully aware that what's happening is a result of things that happened to us early on. And again, we could have had a perfectly fine childhood, but then as we get older, we start going through things where we can't count on our partners, where somebody leaves us, where remarkably several partners leave us. Um, that disruption can come at any point in the lifespan, and repair can come at any point also.
So I know autistic and ADHD people are often misunderstood, punished for things they can't control. How can repeated experiences like these shape a person's nervous system and self image?
Another very good question. People with autism, especially people who are on the more, for lack of a better word, normal end of the spectrum, um, are often seen as just being slightly quirky or unusual. And that may be enough to put some people off and create a sort of a perceived distance between people. I don't understand why people are treating me like I'm different. I don't understand why people are being like dismissive of me. And the fact of the matter is, in addition to the sometimes insensitivity to social cues that you see, we may be experiencing how people react to people with autism. And ADHD, very similar. Two of my children have severe ADHD, and they have received medication for it at various times. Neither one is on any medication for it right now, but they miss things. They are in school and they hear instructions and they may pick up on part of it, but they may miss some other parts of it. And sometimes kids with ADHD and adults with ADHD will sort of fill in the blanks. I use this example with people a lot. Suppose you go to a movie in a foreign country and you don't understand the language. Why you would go, I don't know. But anyway, you go and you watch the screen and you try to figure out what's going on. And you're like, they're speaking something. Okay, well, this guy's doing this to this person. And you go out of the movie and your friends say, so how was the movie? And you tell them what you think it was about. And they're like, did you see the right movie? No, that wasn't it at all. But ADHD can be like that also, and so can autism, because you pick up some of the cues, you pick up some of the things, and your brain just kind of fills in the rest. And what is happening there is you're operating on a slightly different level of reality than everybody else is. And when people perceive that, they can judge you, they can be angry with you. A lot of parents of ADHD kids will say, oh, they lie all the time. Don't really lie so much as they're trying to fill in the blanks. They're telling you what they think is true. They're telling you what they think is right. But um, if they only heard every third thing that you said, they're just going to assume that the rest is in keeping with that.
Like, how can someone distinguish between autistic traits, ADHD traits, trauma responses, anxiety, or burnout when those experiences overlap?
Sometimes you can't. And the fact of the matter is, a lot of those syndromes, situations that you mentioned, I'm getting less and less fond of the word diagnosis as time goes by, but a lot of those things have some similar features in the sense of some disconnection with people, some difficulty in processing, some difficulty tracking, some tendency to get hung up on things. Um, I knew a woman once who was really enamored with a particular band from the 90s, and she knew everything about them. She knew what shirts they wore when they were recording. She knew every lyric to every song. And, a lot of people with autism spectrum disorder are very fixated on something. They have their thing. And so that is something that, and you couldn't challenge her on it because A, she knew everything, and B, she would become quite angry if you tried to dispute it, because she was the expert. And again, people with complex trauma repeat some of these patterns in the sense that they will assume that something is going to be a certain way, and they're absolutely convinced that's the way it is. And they are reading cues from other people, but they're not reading them the same way that maybe you or I would. They are reading someone's silence as a rejection. They're reading someone's ambivalence as hatred. They're reading too much into a situation. The perfectionistic tendencies sometimes get in the way at work, and perfectionism is something that some people use to cope with ADHD and some people use to cope with autism. Also, some people with complex trauma because they just want to be good enough. A lot of them are dealing with shame also because they felt that they weren't good enough at one point.
I know trauma is often discussed as a story someone can tell, but it also lives in the body. What does it mean to say the nervous system learns survival patterns?
Uh, well, the body does keep the score, and we learn that certain things are activating. I hate the word trigger because, I mean, when something is triggered, like you pull a trigger and the bullet goes out of the gun, there's no controlling it anymore. I like activation better because when something gets activated, when a feeling or an impulse or a memory gets activated, you have a choice about which way to go with it. And the ability to stop and take a pause and say, okay, well, I can assume this or I can assume that. Um, and a lot of people become over functioning and they burn out because they're trying to overcome shame. And when something feels like they're not doing enough, they'll do more and then they'll do more and then they'll do more. And of course, the boss says, wow, this guy can do anything. And they give them more to do. And it goes around and around.
How might fight, flight, freeze, fawn, shut down, perfectionism show up in adult life?
Well, we've come to realize that there's more than fight and flight. As you mentioned, there's also freeze and fawn. Fighting and flighting are about being able to either fight off something that is impossible to deal with or run away from it. Fawn is essentially what shame makes you do, which is, I'll do better. I'll do more. I'll do anything. Just don't hate me. And freeze is when you just absolutely can't decide what to do and you dissociate. And dissociation is a big part of complex trauma also. People who just can't be in this reality anymore, they just either zone out or they have an anxiety reaction in which everything feels weird. It feels like I'm looking down a long tunnel. It feels like people are robots. Sounds psychotic, but it's actually a really normal response to severe anxiety. And again, if your nervous system is on hyper alert all the time, you're always just as close to dissociation or to hypervigilance. So again, you're just very finely wired.
What is it when people say, I know I'm safe, but my body doesn't believe it?
That's a good one. You're and interestingly enough, I was just talking to somebody earlier who's like, I wake up like this and I don't even know what it is. It becomes a pattern. It becomes a sort of a chemical rut that your brain falls into and it's not just your brain, it's your nervous system also. I mean, this is all connected. So your body senses waking up, it's immediately goes into high alert because at some point or other, that was what was needed in order to survive, or that was what was needed when you couldn't let go of the pain or the trauma. So being able to be on alert is it's very debilitating. It's exhausting.
How can complex trauma affect like the way people choose partners, friendships, workplaces?
Again, if you have a sense of shame, you will do your best and you'll overachieve and you'll do better, but you may not be able to sustain that. And the first time that you can't, your partner might say, what's wrong? Why are you not? And it's funny how people tend to find people that are sort of opposites of them. And you with complex trauma may find somebody who is a little more cold and aloof. And you'll spend your whole life trying to be a good partner to them, but that's just not in their temperament. Our temperament is kind of hardwired into us, and we can change that over the course of time. We can learn to work with that, but cranky babies become fussy adults, and therapy helps and personality helps, but to a certain extent, you'll always be a little fussy. So, whereas some people who are really um, terribly organized and very obsessive compulsive can, through the course of therapy, just learn to be very careful and good organizers. And you want to have them around because they're the ones who always check everything and make sure that everything's right. So again, you can learn to use these things to your benefit, but um, fighting that nervous system thing is something that happens over a course of time. There is no off switch. People ask me all the time, they say, "You're like a magic wand." I actually keep a magic wand on my wall, Harry Potter style thing. And I'm like, well, if I could wave this and change everything, then we wouldn't need to meet more than once. But also, the repair takes time. It's repeated presence, repeated interactions in which I'm glad to see you. Everything's going okay. And you can have a bad day. You can have a bad moment, but that does not mean that you're back to square one. That's another phrase I hate. Square one. Um, you don't go all the way back. You have gained, and those experiences of repair stack up, and they matter. But again, they can be damaged by a single bad occurrence, and you can go back to that pin again. But maybe this time you don't drag so much of it forward, and maybe you don't go all the way back to that pin.
Why can boundaries feel unsafe or selfish when people are just, you're supposed to just have them, but we don't want to produce them or we run over them?
Boundaries are like they're more doors than walls. People tend to see boundaries as being absolute and shutting everybody out. But I mean, if you think about a house with walls and no doors, that's not a house, that's a bunker. That's a box. And, you have to be able to have somewhat permeable boundaries and be able to open the door, close the door. I sometimes tell people, put the chain latch on and just peek through until you're ready to open it all the way. Boundaries are not necessarily bad things. They are about standing up for yourself, knowing how much you can take, and being able to be assertive about that, knowing what you want, and being able to reach out for that. But boundaries that wind up shutting you off from everybody, boundaries that wind up being very hard and inflexible, are difficult to live with. And some people have those. But, again, they may find themselves being alone and wondering, why am I alone so much?
Does a repair conversation look like in a healthy relationship when somebody's been activated, shut down, or misunderstood?
I love that you're using all my terms. I like that. Um, what is a repair conversation would be something along the lines of, we also have to be aware of trauma informed language, which is you don't say to somebody, oh, why are you doing that? Or that's bad. But we also don't want to say, you did great with that, because that's passing judgment on the person. And that's a friend of mine, Caroline Joy, she talks about this a lot, trauma informed language. It's about being able to just be there with the person in the moment. So, what was that like for you? Is a trauma informed way of saying something. Uh, I noticed that she said thus and such. Why did you choose those words? Why did you say that? Um, Instead of rushing to a conclusion. So that's a repair sort of statement to me. Why? Or how was that for you? Or what could that have been like when you've been through so many things? Even being able to acknowledge that the person has been through traumas. So it's like it's just being able to have a it's like being able to have a conversation about, sorry, my watch was ringing. Um Having a conversation about what happened and how do we deal with this differently. with support and understanding.
Now, your work emphasizes hope grounded in evidence and lived clinical experience rather than just push through culture, which is popular. What does genuine resilience mean?
Genuine resilience requires connection. Being able to be resilient requires that you have someone that you're able to trust, that you're able to connect with, that you're able to feel is accepting of you. We found that, I mean, there have been so many studies on resilience, and they found that kids, for instance, in school who have clubs that they can be part of, and or they may have a special teacher that they really can find relatable. Those things are very valuable in terms of being able to make a sense of connection so that you can feel like you can handle things. And again, you may not feel very resilient sometimes if you're suffering with throes of hypervigilance, if you're suffering through shame. But if you dig down deep, it's in there. And sometimes working with a therapist, you can find these things. I don't say that just because I'm a therapist. I do think there are times that everybody might need that. And, this is a person who's professionally trained to be able to know what you're going through and to hear this and to see it.
What makes a treatment approach trauma informed in a meaningful way versus using trauma language?
Um, it's being able to be there. It's being able to hold space for, it's part of why I call my podcast what I do. Being able to hold space for that person to understand, to say, what was it like for you? What are you feeling now? What's going on for you? It's very different from being able to pass some sort of judgment on the person.
What questions can listeners ask themselves when they are activated, overwhelmed, or people pleasing?
Do I really need to do this? What am I thinking is going to happen next? What might really happen next? And what choices do I have? Because if you automatically assume that this conversation is going to be like every conversation, and this particular interaction is going to be like every other, or that message is never going to get returned, then you've already decided how everything's going to work out. Stop, ask yourself, what else could happen? What else could I do? What else could someone else do that would break the pattern? And these experiences or repairs stack up gradually. And it's never too late to start. People in their 80s who are just learning how to deal with this. There are people who are in their 20s who are still learning to deal with this. We don't have to go all the way back to childhood to deal with it. We start now.
Somebody considering therapy, what should they look for in a clinician if they want support with complex trauma, attachment, or neurodivergence?
First of all, try to find someone who definitely understands those terms. It's okay to interview people, and I've had people who would have one session with me just to see if we are on the same page. That's good to do. Say, I have been suffering with ADHD most of my life. Do you have any idea what that can be like? What can you tell me about it? What's your understanding of it? Try to get a feel for where they are so that you know if they are trustworthy and you know if they are well informed.
What is a tool that people can use that can slow down a shame spiral before it becomes full blown meltdown?
Uh, Again, the pause, just being able to take a step and go, feeling really bad about myself at this moment. I know this is an old pattern. What might actually be happening here? What choices do I have? What could go different this time? And is this really about me being bad? Because I mean, if you're operating from a shame place, you're going to feel like everybody's judging you and they're not judging you well. So being able to stop and say, is this person really judging me? Is this something that is justified? Because sometimes, especially after relationship problems, people may be on the attack. That does not mean that they necessarily are rejecting you. They may just be rejecting your behavior. And then you can stop and say, okay, this is about my behavior and I can change that.
What gives you hope about people's capacity to heal, even when the patterns have been present for decades?
As long as they're trying, as long as they're doing the work that is involved, I have a workbook that's going to be coming out, I may have mentioned, and there's some exercises in there. But as long as people are trying and engaged, we try to, as therapists, see that a person has some sense of engagement. They're not just coming and talking at us. But when they say things like, last week when you said this, that means you're paying attention. That means they're engaged. That means that there's a relationship that's happening here. And there have been studies. We know that a lot of the healing experience of therapy comes from that relationship, of feeling attached to that person, of being able to feel like there is give and take. It's not just me talking at them. We're able to communicate.
Okay, final question. Where can
Okay.
listeners find your articles, Holding Space podcast, and keep up with your book launches?
I'm on LinkedIn a lot. I publish something almost daily there. I have a website, drchristopherbarker.com, just DR, I've just gone to word doctor. Um, I have the podcast, which is properly known as Holding Space with Dr. Christopher Barker, because there actually are a few podcasts entitled Holding Space. I did not realize that at the time. It just seemed like a really good title. But you can see me there. And on the website, drchristopherbarker.com, there is a relational time quiz that you can take that sort of gives you some idea of how you are handling various things. Hypervigilance. Are you a watcher? Are you the sort of person who is shame based? And knowing these things is not a judgment about you. It's like, oh, so this is what I need to attack. This is what I need to do differently.
Dr. Christopher, thank you so much for coming on to my podcast.
Thank you for having me. I appreciate it.